Meanwhile, researchers with Siteman Cancer Center are also testing cancer drugs to help treat COVID-19 patients. And joining me is the Deputy Director of Siteman Cancer Center, Dr. John DePercio. Good morning, Doctor.
Good morning.
I think this is fascinating because when we discuss cancer, what is cancer but inflammation? And what is COVID-19 doing to the lungs but inflaming them?
That's right. So we've thought that perhaps some of the drugs that we use to reduce the inflammation associated with cancer could be applied to COVID-19. And that's the underpinnings of several studies that we're planning and are presently at the FDA for evaluation.
Explain what happens with some people with the virus. It gets into their lungs and the body's immune system reacts to kill the virus, but it also kills the healthy cells.
Right. So the interesting thing about the terminal events in COVID is that there's a severe inflammation of the lungs, which occurs at the time when the virus is least evident or at the lowest level. So the virus titers or viral loads are decreasing dramatically at a time when there's the greatest inflammation. So we think that there's a very strong immune response to the virus and the infection by the virus in the lungs that causes this severe precipitous inflammation in the lungs that can be life-threatening or life-ending. And so these drugs are applied in a way to directly block some of the pathways involved in the immune cells that actually cause this inflammation.
Is one of the tests you're doing, does it deal with the MSC, the stem cells?
No, not with the stem cells, but primarily our studies are aimed at blocking T cell and macrophage function. So the two cells that are really involved in the inflammation are the immune cells called T cells and the cells that make all the bad cytokines, macrophages. And these drugs both either enhance the activity of T cells to clear the virus or block the ability of T cells to activate the macrophage to cause these inflammatory events to occur.
Yeah, those events are called, what are they called, cytokine storms?
Cytokine storm or cytokine release syndrome, yes.
Just horrible when you hear about what it's doing inside of the body. So you are having some success with 1, 2, 3, 4 drugs?
So we have 3 trials. One trial we proposed to the FDA and they told us to do a randomized phase 3 study, which is now being evaluated by the FDA, and hopefully that will be approved. A second study is using a drug that we use for patients with chronic lymphocytic leukemia. And that drug we found in our laboratories to actually block that cytokine storm in the production of these cytokines from macrophages. And the third drug, ironically, is a drug which enhances the immune system because many of these patients early on have profound decreases in their immune function, and that may contribute to the persistence of the virus in patients.
Fascinating. Well, I'll let you get back to your work. I did want to mention I was speaking with one of your colleagues the other day, Dr. Russell Paczynski, and he stated that some people are hesitant to go back to Siteman Cancer Center, and he said to get the word out, we're safe here. People need to get back into the routine of seeing their doctors because it's very important.
Yeah, I would reiterate that. First of all, our activity is at a level that it was before COVID, and number 2 is that patients are absolutely safe at Siteman, and number 3, patients need to get their cancers treated appropriately in a timely fashion, and we can't delay the treatment of cancer because there's a threat of COVID.
All right. Thank you so much for joining us, Doctor. And that research we were just discussing, we have a link to the Siteman Cancer Center on our website. It will be on fox2now.com and also the Fox 2 mobile app.